here. I'm going to be your PA today. So when I come in, I'm going to look at my patient's overall appearance. I'm going to check if they look acutely or chronically ill. I'm going to see if they appear happy and content and look for any signs of anxiety, respiratory, cardiac distress, depression. Overall, my patient looks healthy, well-groomed, and looks well-dressed for the weather. Next, I'm going to look at my patient's skin and look to see if I see any primary lesions, ulcers, or secondary lesions. I'm going to feel my patient's skin for proper moisture, texture. I'll check for turgor bilaterally. I'm going to check my patient's capillary refill, make sure that he has adequate perfusion. I'll check for clubbing bilaterally in the hands. I will also check bilaterally in the feet for clubbing and capillary refill. I will overall look for any jaundice, cyanosis. I will check for pitting edema bilaterally by pressing on the tibia. Next, I will inspect the patient's hair for any nits, lice, deformities, any hair loss. Next I'm going to feel for the patient's radial, brachial, and carotid pulses bilaterally. I will ask the patient to step on a scale and record their weight and height so I can determine their BMI. And next I will take vital signs. Okay, so I'll take the patient's temperature, place it under their tongue. So first I will feel the radial pulse and notice when the pulse disappears when I pump up the blood pressure cuff, and this will prevent an error an oscillatory gap, and so that I can approximate what the systolic pressure is. Okay, the temperature is 98.6, which is normal. And his radial pulse disappeared at 120, so I'll pump it up to 150. Okay. The cortical sounds that I heard are the systolic, which are 120, and when they disappeared, those are the diastolic, which was 80, which is normal. Okay, next I will take the respiratory rate, and normally you do this for a minute, but I'm going to do it for 30 seconds for the sake of time, and the next 30 seconds I would be counting the respiratory rate without my patient knowing. Okay, so 30 seconds went by, and the patient's pulse was 80, and the respiratory rate was 16.
Okay, we'll be doing the pulm exam now. So the first thing I would do is check for any distress in the patient or any signs of trouble breathing or any signs of them using their accessory muscles to breathe. I note their posture is normal and everything you do in the general survey, but general exam, we already did that. All right, so I'm going to check the patient's AP diameter, posteriorly and laterally, which is normal. And now I'm going to check thoracic expansion by going behind the patient and asking her to breathe in a deep breath. And thoracic expansion is about 1.5 centimeters, which is normal. Next, I'm going to percuss the patient. You should hear resonance over the lungs, indicate there's air. And I'm going laterally, both sides before I go down. Okay, now I'm going to do the diaphragmatic excursion test. So I'm going to find where the diaphragm is by noting where the sound goes dull. I'm going to ask the patient to take a deep breath in and hold. So I found the diaphragm. Now I'm going to ask the patient to breathe out. And I'm going to mark this spot. And then I found where the sound, the dullness is, and that's where the diaphragm is. So it's about 3.5 centimeters, which is normal. And I'll do that bilaterally. And now I'm going to palpate the patient's back and ask her if she feels any pain. I'm going to note any inflammation or tenderness, which I don't feel. I do that anteriorly as well. I'm now going to check the patient's axillary and supraclavicular lymph nodes for any swelling or tenderness, or any pain. So this is supraclavicular. Now I'm going to check axillary. I should probably wear gloves. She's sweaty. Everything seems to be normal. Now I'm going to listen for breath sounds for any signs of crackles, wheezing, or rales. I'm going to ask the patient to take a deep breath in every time I put my stethoscope on her back. Making sure I hit the lateral aspects too. Okay, now I'm going to perform the tactile fremitus. You ask the patient to say 99.
99, 99, 99, 99.
And everything seems to be normal. I can perform everything anteriorly as well. If there was any abnormalities, I would go on and do the vocal fremitus tests.